everyone. This is Jamie Marboe Nichols, and I am the host of the Heart of Dentistry Podcast, where we take the ache out and put the heart back in to our dental profession. Please join me as I interview various guests who have opinions and also solutions to what is going on in our profession and helping us put the heart back in. Hello, everyone. This is Jamie Marboe Nichols, and I'm so excited to have you join us for our podcast for the Heart of Dentistry. And my guest today is a dear friend. I have goosebumps introducing you. This is Amber Young. Amber Young and I met, I don't know how many years ago. I want to say about 8 or 9, 10
Yeah,
years
somewhere in there.
ago. I'm trying to think the first time. I don't know if it was at Do, Dental Entrepreneur Women, but Amber has a very unique story, and I it's not as unique as it should be, but it is unique in the way in the type of story that Amber has. And so, Amber, you live in North Carolina, Charlotte area, and you don't know, you're not clinical minded, and dentistry came to you. You kind of fell into it because of your unique story. So
Yeah.
there won't be a lot of clinical questions. While I think you could probably answer some of them, you've never been a hygienist or an office manager, right? Or you've never done dental assistant or anything like that. So I'm not going to ask you a lot of clinical stories, but why don't you go ahead and introduce yourself and tell us a little more about you.
Well, my name's Amber Young, and I am an oral cancer survivor, and that is what threw me into dentistry. Um, Full force, both feet ahead, right into the mix of it. My story kind of I went public with my story on Facebook, and then it snowballed into within 24 hours of my GoFundMe, reaching out to some of the key players in dentistry that I had no idea about.
Yeah.
Um, but basically, I was that dream patient with that $99 coupon coming in for a new new patient exam. And at that exam, the practice offered an oral cancer screening in addition to the panoramic and the things that they offered as the new patient exam. I opted to take that for the $20 fee that they had, and it turned out that I had a dark spot on both my panoramic and my Velscope oral cancer screening that they did. Um, I didn't know what that meant. A dark spot's a dark spot. I didn't have any kind of pain or symptoms. And the dental hygienist, the practice manager, and the dentist all came into the operatory at the same time and said, "We really need to talk about this. You need to seek another a profession, which was an oral surgeon, to get better imaging of this dark spot."
Yeah.
And they referred me to someone that was in a different state at the time, and my insurance didn't take it, so I didn't go because I'm
Mm.
that.
And
Yeah.
did you feel at the time, did you feel like there was a certain kind of urgency, or did you feel like it was more, it'd be nice if you went? Is that how you took it, or you just really just pushed? I mean, tell the listeners, what was your age, and tell us a little bit about what was going on in your life already, so that they don't think, well, why would you?
Yeah, so I was 35, right? I had just recently had my son. I had been to the dentist probably about a year and a half before, right? Before we moved to North Carolina, and had x-rays, had all the things, and there was no trouble. I just needed to have some cavities filled and things. And I opted to wait after I had my son because I was pregnant and didn't want to do it all while I was pregnant with
Yeah.
him. Um, and I didn't have
But
any
no
pain.
signs of the oral cancer at that dentist the year and a half
No,
before.
nothing.
No
And I
signs
didn't
at
have
all, a
any.
year and a half before. I think that's important that you had no symptoms, no x-ray that showed anything that was
Mhm.
unusual a year and a half before this day that you're in the operatory. They're saying, hey, we've got some concerns. So
Yeah.
you didn't go see the oral surgeon right away and go on with the rest of
No,
the
so
story.
I didn't. I didn't go see the oral surgeon. And then about 2 weeks later, the practice manager called me and said, "How did your follow-up go with the oral surgeon?" And I told her, I said, "Oh, I didn't go because my insurance wasn't accepted. It's in a different state." And she flipped. She was like, "This is unacceptable." I said, "Okay." She's like, "This will not stand. Like, we're gonna find you an oral surgeon that takes your insurance and you need to go get this looked at. Like, this is serious."
And
And
that's when you felt the urgency. from her, that phone
Yeah,
call
I
from
was like, that's kind of
from
wild that this.
the practice manager. I just think these are crucial things to point out that they followed up, and it was the practice manager that called you, and she made it
Yeah,
sound more
and I thought it
urgent.
was super weird. I was like, okay, this lady's going a little bit extra on me here, so maybe I need to go and get this done. Um, so they referred me to an oral surgeon. So it was probably about within 3 weeks after that first initial appointment, and I went, and there they did the 3D imaging, right? And at that time, that dark spot that was on my X-ray and on the Velscope imaging ended up being a golf ball sized tumor that was growing inside my jawbone internally on the back side. It was breaking my jaw and it was pushing the nerve out of the way simultaneously, which is why I didn't have any pain. I didn't
Hmm.
know it was there. So there was no protrusions on my face. There was no pain associated with it. And I mean, I could see it clear as day, big as 5 centimeters mass. And I was like,
Wow.
huh, that's a little wild. So he biopsied the surface of it, which he could get to by taking out a wisdom tooth, um, and sent it off and said, we'll wait for that pathology to come back and come up with a game plan. So 2 weeks went by, pathology came back. He told me it was non-cancerous. Right? Yeah. So this is part of the story I don't really tell a lot of people, okay? So he said, "Oh, it's not cancer. Great news. But it's too big for me to take out here. I need to refer you to the medical university here in South Carolina so you can go have it removed." So fast forward another couple weeks, I called my mom. I told her it wasn't cancer. She's, doing the happy dance, all the things. And we went to the Medical University of South Carolina for that appointment. And as soon as we got there, the medical director of the dental school came in and he said, "I know you're worried about the pathology report." And I was like, "No, that guy told
No,
me that
I got good
everything." No, he's
news.
like, "No, this dude told me everything was fine with pathology." He's like, "No, it clearly states there was a note at the bottom of the pathology report and it said it did not react well with one of the dyes, K19 specifically. And we need to actually have another biopsy because something is abnormal here." And I was like, "Oh, that's wild, but okay." He said, "So we're gonna have a surgery, take out the whole mass and biopsy it, and then we'll figure it out from there." So we went in, we did the surgery. They told my husband after the surgery was done that it was fine. It looked great. It was clear. It was round. There was no nodules. They didn't think there was anything for us to worry about and sent us on our way. They'd call us back in a couple of weeks when we had the pathology report.
Yeah.
So we went off of how they were kind of leading us into this conversation, right? It's
Yeah,
3.5
exactly.
hours away, at the beach, right, in Charleston. So we took the kids with us, right? We took my 8-year-old and my 1-year-old, drove down there for the day, made the trip. Jamie, I kid you not. We walked in to where the room was, and 6 doctors were already in the room, and the residents lined the hall. Like they were lined
Oh
down the hall.
my, this is just the
Yeah.
follow-up that this was just you going back for a follow-up on that biopsy of taking the
Yeah.
whole tumor
And
out.
and all of them, there was 6 doctors in the room waiting, and the residents were just
And
lined
here's
up.
you and your little family
And
coming
so
in.
my husband was sitting on the window bench with the 2 kids when they started to deliver that information, right? That it was the rarest cancer they'd ever seen. They didn't know what to do. It was 95% aggressive. It always metastasized to brain cancer and lung cancer and killed everyone within 5 years. They did not know what the treatment course was going to be because this type of cancer wasn't receptive to chemo or radiation, and they needed to take a pause. They needed to send me home. They needed to go out and talk to all the radiologists, oncologists, the teams, and go to the tumor board and come up with a plan and basically call me back someday and tell me what they were going to do.
Oh
Right.
my.
And
Ugh.
yeah, I remember looking at my husband in the window with the kids, and I literally made the sign. I was like, "No, like we're not gonna do this today because they don't know what was happening, right? And understanding that, and we came to the beach to have a great day, and that was the longest, quietest car ride home I've ever had in my life. Like I
Yeah.
we did it just. I didn't know what to say. We didn't have an answer. There wasn't a solution. I Googled it. My official diagnosis, which was clear cell undogenital carcinoma, and there was nothing. So this is 2015. There's no help group, there's no research, there's no clinical studies of people having it historically. There was none of that data there, like nothing. And I was like, huh. What?
That's not necessarily good because usually you have so much information on things and it's a lot of misinformation, but you get not finding anything.
Yeah. No, I had nothing. So I'm a data person. I know this after going to do and things like that. Like I rely on statistics, data, research, and information, right? We did everything I could possibly do. I went out and I bought all the case studies from the early like 1980s in third world countries of cases that of this particular type of cancer. It was all elderly women. There was 74 cases before me. All of them were tracked as best as they could in these kind of indigenous countries and things.
Yeah.
They all died. Everyone, every single one of them. My dad and I went through them, we read them, and we basically had a conversation and said, well, we're not going to talk about this anymore. Like, this isn't it. And waited. I did everything. I called the CDC, right? Because surely they
Yeah.
have some information. Um, I was told that I was too rare for them. There has to be a certain number of people afflicted with a particular type of disease for there to be research, right? And
Yeah.
there wasn't any of those. It was me out of 7.3 billion people in the world. It was me, right? So it took
Wow.
a month.
So well, I guess imagine what you're thinking here. I know you've told this story a bazillion times. I don't want to gloss over some of the human side of this, of what you're
Yeah.
going on as a young 35-year-old, a brand new
Mm,
baby, an 8-year-old, and, just starting your life over almost,
yeah.
I know your background and where you were at and moving and a new job and new stuff. Tell me at that moment, what kind of, if you're okay with sharing it, but what kind of
Yeah.
conversations did you and your husband have at night when the kids were tucked away? Were you trying to be real positive? You're a frank, in the face person now. I don't know what you were before that, but you don't sugarcoat much at all. Have you always
No,
been that way, or did
this is
this?
authentically me. I'm always
Yeah.
this. Um, I I needed something, right? I was a very, I'm not gonna lie, like the person before cancer, the company I worked for, they had names for me, right? It was the tyrant. It was very strategic things. I controlled every aspect of my life, Jamie, right? Every single one.
Mhm.
I knew the kids' schedule, what I was doing, where I was going, what I was doing. I planned for everything. The universe gave me the one thing that I couldn't control. I couldn't find answers. I didn't know what to do. I was lost as a person.
I can't even
I,
imagine.
right? Because there was no answer for me. Like I needed to dig and find the bottom of the answer. And there's not one. It wasn't hereditary. It wasn't environmental. It wasn't statistical. I didn't
Yeah,
fit
because you
any
weren't a
of the
smoker. You weren't,
stereotypes. Right. I wasn't of
you
an
had,
age. I wasn't an alcoholic. There was no clue. So to be a person who's controlled every aspect of their life, to be given something so huge that you have no answer for, man, that threw me off. Like that threw
I bet it
me.
did. I bet it changed everything. And I think your husband met him, wonderful, wonderful soul. He just wanted to make everything better for you. I'm sure he was lost knowing I can't take this
Yeah,
away. I can't. He
we
probably felt
can't.
helpless at times.
We couldn't do anything. Like there was nothing that we could do other than wait at this particular time, right? I had to
Yeah.
wait to see what they were going to come back with. Science didn't really do any good for me at the time because chemo wasn't going to work and radiation wasn't going to work. So there was no option there. And it took them a month. It took the doctors a month to call me. It was Memorial Day weekend, and they called and they said, "Okay, we got a plan." I said, "Oh, okay, what is this? What's the plan?" They're like, "We're gonna cut out your face." I said, "Excuse, what's that?" They said, "It's a 22 hour, it's gonna be like a 22-hour surgery. We're gonna cut out your whole entire jaw. We're gonna take the biggest portion of it we could possibly take from your ear to the front of your chin, and just anything that tumor could have touched, we're cutting out. You're going to need to just make a decision about if you're going to give up your fibula or your scapula, like my leg bones or my back bones, right, of my shoulder, as a donor site for muscle and for bone to fuse I call it my motorcycle chain together into my face. Um, and I remember I asked the doctor, I was like, okay, all right, let's talk about this. What if I don't want to do the surgery? And he's like, well, there's one quick answer. He's like, you're going to leave here on hospice. We either do the surgery or you go home on hospice because it's about 2 months from entering your bone marrow channel and there's no stopping it at that point. Like, that's it.
2 millimeters, did you say?
2 milliliters. So, like, within about 2 months, it would have entered my bone marrow channel. Had I not discovered it at that
Had
dental
that
appointment,
hygienist in that dental
they would have
office not
left me.
offered it and you not said yes, because we know how many people say no
Hmm.
to the 20 extra dollars, especially
Hmm.
young couple, just moved, all that stuff.
Yeah.
So all of the stars were in alignment at that moment because you not only, oops, that happens to me a lot because I talk with my hands. You not only said yes, they offered it, you said yes.
Hmm.
I'm sure you threw their whole schedule off that day, but who cares, right? Because that's what they
What do
want to
you
get
do?
you. It's like they didn't care. Trust me. They just saw
Yeah.
this young woman there. And then we had 2 weeks later an office manager take the time to call you
Hmm.
and make it urgent and make it work. That's the silver lining in this part of it is that because the whole my Heart of Dentistry podcast is taking the ache out and putting the heart back in. And I that's the part. And I mean, we're having this interview, we're having this talk, so we know there's some good news, that
Yeah.
we're going to be sharing in part two, because I already know we're going to be doing a part two. But just the takeaways from just these first 10 minutes I think is something that I'm hoping that my dental listeners are paying attention to, and possibly some dental patients. We're all patients. We may be in the dental profession, but we are sometimes the worst people of taking care of our own oral health.
Yeah.
So I just think that we pay attention to she offered it. She could have easily already been behind and said no. You could have said no, but you said yes. That office manager could have said, I'm too busy to follow up on our referrals, but she didn't.
Hmm.
So it just goes to show that in our profession, how not dropping the ball and doing what's right every day on every patient is how we save lives one mouth at a time, which is my motto for Marble Consulting is saving lives one mouth at a time.
Yeah.
So we're going to take another 5 minutes and then we're going to go into part two, but let's finish up and I'm not trying to cut you short because this
Oh
is
no, you're
such an
good.
important message. But I want to talk about the scapula and what your thinking was because you said let's talk about this because this to me was pretty profound as a young mother of what you're having to make a decision as to whether it's a scapula bone and muscle or whether it's your leg bone. So let's take it from there. I'm sorry to interrupt, but let's keep going now.
Oh, no, you're good. Well,
So
it was pretty simple. Like my husband and I talked about it. I was going to lose my ability to speak, my ability to eat, my ability to do pretty much anything here. Right? So we had a two-story house and I had an 8-year-old daughter and a 1-year-old son. As a bare minimum, Jamie, I got to at least be able to walk. All right. I
yeah.
can figure out the other things and I would have one of my arms, right? But the walking thing was the sticker. So and I had heard that if people this is wild to me, if people use their legs, right, to do their donor sites, sometimes you would grow hair in your mouth and that freaked me out. Like freaked me out. Like I was like because this is a big piece of the muscle, and they take the skin, and some people would have hair
Oh my gosh.
in
Yeah,
their
I
mouth, and I was like,
I
"Yep,
I
that's
don't
it."
blame you. Just think if you were a hairy beast of a guy and the
Or,
scapula or the
but
leg.
years of shaving my legs, that skin had that
Yeah.
possibility, and I
Yeah.
was like, "Okay, that's creepy
The
enough." So,
things you're having to think about where before it was just thinking about what kind of formula and diapers to buy, you know?
yeah. So
Ugh.
My ultimate decider, to be really honest, was the hair on the leg.
No, that's good. I like the honesty and the
I was creeped out
vulnerability.
by that. So I chose my left scapula because I'm right-handed. And so made some really hard decisions. They scheduled my surgery within a month. We were there. This was Memorial Day weekend. I was there Father's Day weekend, so June 20th. So within 18 days, I was there.
Yeah,
Um, has a whole nother podcast about that weekend,
yeah.
because it was in Charleston during the shooting that happened at the Baptist Church, and everything shut down when I was due to go in for surgery. And
Oh my
like the
gosh.
one person I talk to God every day. I'm like, listen, I am putting all my faith in you with this. The doctors that know what they're doing, we're gonna make it, that the kids are gonna be okay, that we're coming out of this. Because when you go in for a surgery like that, things I didn't know, I had to sign my last will and testament on top of the hood of a truck in a parking lot at a Publix. I had to have everything in order for what my children were going to do. I had to cut off Cypress's hair because I wasn't going to be able to brush it for months with my scapula being down. Um, there was a lot of things that happened so quickly, so
Where
quickly.
did you get the most advice from on these things? Or did you just think of them on your own? Because I wouldn't have thought about cutting my child's hair because I wouldn't be able to brush it. Honestly, I
No, I had to think about all the things. I had to write him letters in case I wasn't coming out of the surgery. I had to finalize legal paperwork. I had to ensure that, my husband knew if something happened, what to do, where to go, and things that I guess I had never thought about
no
because
35-year-old
literally.
year old should ever have to be thinking about. Nobody wants to go through that, but let alone a young mother. So you had the surgery and it was supposed to be 22 hours
Mhm.
and it was,
Well, they said 20 hours. When I went in, they said there's a good possibility you need to understand this, that if your flap isn't viable, we're going to try for every other viable location we can try for, basically. So they had told me if the first one wasn't viable, they'd take my second scapula, they'd take my fibulas, whatever they needed to get me through the surgery, because they sliced my carotid, they sliced my jugular when they slice. I don't know if you can ever see it, but there's a scar from my ear to my
mhm.
front end. And they stopped my heart, right? And they said there's a possibility you might not come out. We just need you to understand. And my husband waited in that waiting room 22 hours for me. He didn't leave. He slept there and waited and watched the board and he could do. But it was 3 days in the ICU and then 10 days at the hospital. Um, uh, and we made it out. And that's what
Yeah,
mattered. That's what mattered. There was
yeah,
weird goals in there you never thought, like eating yogurt, to not have to leave it with a feeding tube. They had something called a swallow test. And the life expectancy on a feeding tube is less than 5 years. So I did not want to leave with a feeding tube, and I knew that from my research. And they took me in, and I failed my first one. I failed it, and I couldn't speak, and I had a text to speech app that would also cuss for me. So that I liked that a lot. Communicate with my nurses because I wasn't able to talk to them. I had no way to speak. So to tell them that I was in pain or I needed something, I got a text app. Don't get a dry erase boards because nurses like to take your dry erase markers. So I got something called a boogie board, which allowed me to write with my fingernail, and then you could see it. It was like an LED screen. Um, I failed my first one, and I texted. I was like, let me try again, please, for the love of God. They're like, no, you failed. You're going to have a feeding tube put in. I was like, please let me try. Please, please, please let me try. And it's 5 different consistencies of a yogurt that you have to be able to swallow that fifth consistency to be able to not be on a feeding tube. And it took all my might and everything I had, but I made it, and I
oh
didn't have to go home
wow.
feeding tube. But I ground my food for 7 months and everything was liquid. And I had to drink through a straw in the old school squeeze bottles like you had in the 70s with the bent straw. That was the only way I could get things into my throat past all my construction all the way to the back to get food, basically. Um, it was wild. It was a
Yeah,
journey.
that's crazy. And there's so much to talk about. We might even have a part three series. I don't know, but I think that to tie this up into and put a bow on top of it the best we can, I'm just going to go back to I'm going to be the devil's advocate right now and say I know that as a practicing hygienist for 35 years, I can honestly tell you that our doctors put things on us to do and start in the hygiene chair, especially a new patient exam, starting in the hygiene chair. You know, I just can remember every time my doctor would go to a convention or something like that, I knew there'd be something new that he'd want to my doctor was that I worked for 24 years was a male doctor and sleep studies. Okay, now we're going to be taking FMXs instead of just panos. Oh, now we're going to add anterior PAs and this is back in the day, but I
Mm.
know that a lot of people out there you're being asked to do as clinicians, you're being asked to do a lot in the same amount of time. If there's anything that I'm hoping that talking with you and our story um, brings to light is that you didn't fit all the demographics. You didn't fit any of them, not even close to it yet. A lot of consultants will talk to doctors about doing oral cancer screenings, not me, but because they can increase their revenue with
Mhm.
something that is potentially life-saving. But it always seems like the money part comes in front. And I think that's where maybe some of the hygienists turn their ears off is because they look at it maybe not through the right set of eyes. Not everyone. So please don't send me any hate mail, hygienists. I'm saying this, but I know how difficult that hour is to get everything in and do a great job for our patients. But nobody's going to die from leaving some plaque or not doing a prophy that day. The patient may not be happy about it. And instead replacing that 10 minutes of polishing or I'm not saying don't do probing, but
Mhm.
with doing an oral cancer screening.
Yeah, so throughout this time, I've learned that yes, the hygiene chair is very busy and is very crammed. You have so many things to do in that amount of time. The quality of life that you can save for a patient if you detect their oral cancer earlier, right, far exceeds that. I'm talking about people losing their ability to speak, eat, function, work. Everything goes out the window. Everything goes
Yeah.
out the window. And if you can detect it and find it earlier, they're going to have a higher survival rate. But not only that, like they're going to be able to do shit. And I know that maybe I can't say that word.
You can, you
I'm sorry.
can, you
Okay.
can on my
They're
podcast.
going to be able to talk, right? Or they're going to save part of their mouth that
Yes.
they're able to eat. Like what oral cancer will take from somebody is so debilitating that that extra 5 minutes that it takes to look is,
It's really two.
yeah, 2 minutes then, you know what I mean? Like it is so, it could save so much trauma from somebody on the other side.
Yeah.
And
And
that's
and you
what
know that I'm a big advocate of mental health in our profession because there's a lot of
oh,
depression
yeah.
and suicide is really high in the dental profession. And so I want to bring up what I read some statistics
Mhm.
about any kind of cancer and
Mhm.
depression. And I've heard that depression and suicide tendencies is higher in oral cancer survivors
It
because
is.
they're so depressed over the disfiguring or the lack of being able to swallow and speak and do the things that they used to do, where some of the other cancers, while they're still depressing and life-threatening, you can hide them a little bit easier, but you can't hide. And so we're going to learn more about something that you're involved in leading up to this whole thing about what we find in depression and find and suicidal tendencies and stuff like that with the movement you're doing with oral cancer survivors that is
Yeah.
really really important. So we're going to end here and hopefully everyone took away a couple of key components and please share this podcast with any of your other dental professionals or any of your people that you know that don't have a dental office that is doing life-saving procedures like oral cancer screenings. And it's not the flipping of the tongue with a piece of gauze. It's not that. They would never have found this if they had not done the Velscope. So while the feeling, the palpitations, and the gauze is an important part of the oral cancer screening, it is not going to do what we were able to do, what your hygienist and doctor's office was able to do for you here, Amber. So thank you for being my guest. We're going to end on this note, and we will see you in part 2. Thanks everybody for joining us. The Heart of Dentistry Podcast, where we take the ache out and put the heart back in to our dental profession.